Weir. I'm going to do, I have about 30 minutes here. So I'm going to do some questions and answers, all things Social Security or Medicare. And let's see who joins. I do a regularly scheduled couple of live Q&A sessions every week on Sundays and Thursdays. But as you can see, sometimes I pop up out of the blue when I've got a few minutes because so many people out there have questions, and millions of people aren't getting the benefits they're entitled to, and the people that are about to file for Social Security or Medicare are often kind of overwhelmed and confused about the whole, bureaucracy. And as you can see from the little ticker down there, that I was the former manager of the third busiest Social Security office in the country. Before that, I worked for Social Services doing Medicaid. And many moons ago, when I actually had hair, actually, when I was in the Marine Corps, I had to cut off all the hair. So I guess I'm back to where I started. So anyway, all right. So if you have any questions, make sure you type it in the chat there. And I'm doing this on TikTok and Facebook and YouTube, and we're simulcasting to the entire globe, I guess. So let's see. I did a quick impromptu yesterday. I was going to be on there for 30 minutes. I turned out to be an hour, and I unfortunately wasn't able to answer all the questions at that time. It just ran out of time. So hopefully the people that were there that had questions yesterday, hopefully they join us today. And make sure you subscribe. When you like, that tells the YouTube algorithm to send it out to more people. So you're essentially paying it forward. If you like, then YouTube sends it out to someone that actually might need it as well as you do. And they get the money that they need to survive on a daily basis. So that is a beautiful thing. So if you have any questions, again, just type them down in chat. I've done a few shorts this week. I've been talking about spouse benefits, a lot of questions about spouse benefits, a lot of questions about divorced spouse, disabled widows benefits, which you can get from 50 to 60 years old. David, hey, what's up, David? Possible to use Social Security number as a credit card? Yeah. No. That's one of the big problems with the Social Security card, is that it was never intended to be, a series of numbers for your identifier for credit cards. And so we used to get people all the time used to come into the Social Security Administration and say, hey, I got my, somebody stole my, ID and went and bought a boat or something like that. And how do I do that? And I said, well, has nothing to do with Social Security. It just so happens your credit card companies, your bank, everybody uses your Social Security number. And, Social Security Administration uses your Social Security number for Social Security benefits. Everything else, unfortunately, we can't do anything about, or Social Security can't do anything about. I'm a former manager of Social Security Administration. I want to make that clear. You have to contact the Federal Trade Commission, and you get to a free credit report once a year from each of the 3 credit reporting bureaus. To give you an idea of how things have changed, when I first joined the Marine Corps in 1982, my first duty station was El Toro, California, and we had a barracks with it was nice barracks. It was like there was like 3 Marines to a room, and then outside the window you could they put a label of who's in this room, right? I think at that time I was a private first class, or Lance Corporal Weir, and there was Sergeant Smith, and then Corporal Rankin. Those are 3 people, and I still remember their names. And then it would say Lance Corporal, I think I was a PFC, private first class Weir, and then it had my Social Security number, and it had Sergeant Smith, his Social Security number. So everybody in the world could see everybody's Social Security number. So yeah, we don't do that anymore. So gives you an idea how things have changed. All right, here we go. I got a question here on I'm doing this all simulcast on a bunch of different platforms, but unfortunately TikTok I can't show you my little screens and stuff like that. I guess I need 10,000 subscribers to do TikTok correctly. So if y'all could subscribe on TikTok and everywhere else, LinkedIn and Facebook and friend and whatever you do, it really help. That way we can get the information out there. All right, Zorro Masked Man asks, why do I need to register with Medicare or Medicaid since I'm age 63? You are 63, so you don't have to do either of those. So Medicare and Medicaid, I say this all the time. I've got a video on that, the difference between Medicare and Medicaid, difference between SSI and SSDI. I've got close to 300, probably over 300 videos now on all things Social Security, Medicare, Medicaid. So make sure you subscribe and go through there, and if you have any specific questions, come back. And that's why I always recommend subscribe, and that way you don't have any questions today, and then next month or next week one of your friends does, and then you can't find me because there's so much stuff out there. So it's good to subscribe, and that way you've got a resource for the future. But if you're 63, you don't have to do either. If you're 65, then you have to sign up for Medicare. If you don't have health insurance from current work, that is your work or your spouse's work, and your employer has to have 20 or more employees, then you have to sign up for Medicare. And you do that at 65 years old. Part A is free if you paid at least 10 years into Social Security. And then Part B this year is $174.70. So yeah, and then there's all kinds of gaps with original Medicare Part A, bunch of gaps there. You have to pay $16.32 every time you go into the hospital. Not every time, but up to 6 times, multiple times a year. And then the big one is Part B. Part B has a gap of 20%, so you have to pay 20% co-insurance. So if the doctor's surgery costs $100,000, you have to come out of your pocket with $20,000. That's why almost everybody, unless you got a few $1 million sitting around in the bank that you can self-insure, that's why everybody gets Medicare Advantage or a Medicare Supplement. I always recommend the Medicare Supplement if it works for you. If you need help doing that, I put together a network of partners throughout the country that can help you with Medicare Supplements, Medicare Advantage, Part D, also life burial insurance. Why do I do that? Because I saw the result of not having that over several decades. And then, people say all the time, oh, I wish I would have known that earlier. I wish I'd have done this earlier. And so here's your chance. And full disclosure, if you use our network brokers, they support our channel and make it our ability to do what we're doing here today. So we appreciate it. And this is a free service. So you call that number there, leave a message, and we'll find someone. Make sure you tell us your state. It's all state specific, and we'll find someone to help you out. Oh, super chat. Oh, somebody, 1999. Somebody, you are just too awesome. I appreciate it. Yeah, that's going to put me in coffee for coffee and beer today, and 1 beer Weir. So I'm a lightweight when it comes to alcohol. So thank you very much. I sure appreciate it. Thank you for the support. Hey, Sweet Pug, back again. How's everything? All right, let's see. She's always got awesome questions. Hi, if a person decides to have the VA pension canceled and the widow's Social Security and start their own Social Security, what process is necessary to get that done? Call or what? Yeah, I don't know about the VA canceling the VA pension because that doesn't affect Social Security at all. So, in the future, what I want to do is once we get more we get some more support going on here, I want to hire someone that worked at the VA and bring on someone that's even though I'm a veteran, I didn't do too much with veterans, disability and all that kind of stuff. So I want to bring someone on in the future once we get bigger. Now it's just me and my son. We're a giant organization, just me and my son. And people ask, "What's your son's name?" His same as mine. I'm Ed. He's Eddie. And so if y'all watch the cartoon, waiting for him to have a son so he could be Ed and Eddie, I guess, right? Anyway, old cartoon. Anyway, yeah, the VA pension, not sure about. I know it doesn't affect your Social Security, so that is not an issue. But if you are receiving widows, and yeah, I talked about this yesterday, so this is a great question. So here's what a lot of people are missing. They're missing, and Social Security, unfortunately, is doing a terrible job informing people of this. If you are, um, early retire, or 60, 62, well, let's say 62, an example of 62, or 63 or 64. And you have the choice of either taking widow's benefits or retirement on your own record. Okay. And what some people do is they go ahead and take the widow's benefits, even though it's a little bit lower. And when you go in the file for this, then Social Security person say, "Well, why don't you take it on your own? Because it's more." No, 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 no. Take the widows because it's a little bit lower, because that'll never increase once you start it. But on a retirement on your own benefits, if you take it at 62, 63, then you're locked in. But if you wait, your benefits on your own record can continue to increase while you're collecting money from widows. And then, as Sweetbug is probably, that's what she did. Very smart, awesome, good job. And now she has been on widows, and she's like, okay, now I want to go ahead, and my benefits have increased enough that I want to go ahead and jump on mine. They increase all the way until you're 70 years old. After your full retirement age, they increase 8% every year. And now she wants to go ahead and jump on her own. And that's awesome. All you have to do, Sweetbug, is call Social Security and just as normal, and schedule an appointment, or you can walk in, but always recommend an appointment. So you can do a phone appointment or in-office appointment and just say, "Yep, I want to go ahead and switch over to my retirement," and they'll be able to do that. And I've done a few 100,000 of those. Takes, since you're already in the system, your date of birth and all that kind of stuff is already in there, your proof of age and all that. Yeah, so super, super simple. Probably taking like 15 minutes on the phone to do it, and you are in business. Awesome, awesome. Dr. Weir, yesterday you said that a person can go to any Social Security office. Is that only within the same city or state? You can go to any office in the country. Yeah. If um, yeah, if you're traveling or whatever, or you just don't like your local office, you want to go to another one on the other side of town. Yep, you have every right in the world. When you go there, the person at the front, they might be busy and stuff, and so they might have an attitude and say, "Oh, this is not your office," and you just say, "Well, thank you for that information. I don't care. I like this office. You have nice, clean bathrooms, whatever the case may be." But yeah, they can't refuse service because it's not. If you have a pending case, and particularly like an SSI or something like that, or you have an overpayment that you want to address, then it's best to stay in the same office if you're working on something right now, because they have you know better access to all the information and everything. So in that particular case, yeah, I would stay with the same office. But if you're going in there for something completely new, you can go to any office you want, no problem whatsoever. Yep, they can't turn you away. Social Security is Social Security is Social Security. All right. Let's see here. Chris, thank you for helping us. I appreciate it. Yeah, thanks. Appreciate it, Chris. Thank you, thank you, thank you. MN54, thank you. You're so awesome. Awesome, awesome, awesome. All right, let's see what kind of questions we've got here on the TikToker. Please like and subscribe. Let's see, Marcia, I have A and B plus TRICARE for life. Am I good? Yeah, that's some people want, so that you have Medicare Part A and you have Part B and you have TRICARE for life. So yeah, it's completely up to you. But some people, they wouldn't get a Medicare supplement because that's going to cost, on a monthly premium. Some people get a Medicare Advantage as well, so they can expand their network, and then they get extra supplemental benefits. Some companies offer, dental, vision, hearing, and gym membership and whatever. So it really depends on your particular area and everything. So if you want to kick around your options, in the description on my profile and TikTok, I've got my phone number and my email. So just give us a call. Tell us your name, the state you're in, what you're looking for, and I'll have one of my network partners reach out to you and give you all your options, and that's completely free. And if you choose to just, if it looks like it's best where you're at, then you're good. All right, let's see here. Sweetbug, if you don't want it anymore, just call and tell them. No, the issue of affecting the Social Security, just don't want that anymore. Just call and tell them to stop it, right? Will they ask you why? No, no, no. Well, I mean, um, they might ask you why in the sense of, um, are you sure? Did you get some incorrect information? Hopefully they do that, because a lot of people come into Social Security and they have complete, they heard something crazy on the internet and social media. It's, oh my gosh, I spend probably half of my time, going through all the social media and watching it every day. I find something incorrect that some other YouTuber or TikToker said, and so I have to go in there, make another video, and says, okay, no, spouse benefits are not going away. They're not being reduced by 1%. You don't have to be married for 10 years consecutively. You can have a little break in there. Yeah, I spend most of my time correcting other YouTubers and TikTokers and stuff. So but so that's why Social Security, it seems like they're, Sweetbug, you know what you're talking about, but they don't know that you're talking about. So they're just, kind of looking out and say, okay, are you sure this is what you want to do because of this, that, and the other? And so I guess it's none of their business. They don't have to ask you, but I think it's kind of good that they might. So yeah, but just tell them, yep, I know all the repercussions. But here's what I want to do. And they'll say, okay, cool. Hello, doctor. Since I last contacted you about a month and a half ago on my survivor's benefits, applied last August, called back in September, appointment in office. I called after talking, second part of the comment, to you and was told 2 weeks. Called again after 2 weeks and was told they would make it a priority. Called back in another 2 weeks and was told the last guy did nothing and wait. Oh my gosh. Yeah, that's so somebody dropped the ball. The person, the claims specialist that was taking your case, yeah, completely dropped the ball. And I apologize for that. Um, yeah, that's why, was it tomorrow? Yeah, tomorrow I'm doing a live, and and specifically the first part of it, we're going to be talking about customer service and what we can do to improve customer service, because we can do a lot to improve the customer service, exactly cases like that. Yeah, so yeah, I apologize for that. Then yeah, if they said they're going to make it a priority, and hopefully, yeah, if you don't get some type of action here, then you're going to have to talk to a supervisor. You're not going to be losing any money. However long it takes them, you know, they'll pay you the back pay. So you're not losing any money. But I mean, you like to not have to worry about this stuff, and you like everything to start, and you want your money now. So there's that. Yeah, so, been another 2 weeks, any idea? So, yeah, so the first option would be to call that person's, operations supervisor or the assistant district manager or the district manager. I was the district manager of my office, and, and tell them, here's put a little fire under them. Tell them, if you don't get, any, satisfaction, immediately, if not sooner, then you'll be forced to contact your congressional representative. And, that's kind of a last resort type thing. But if you go on to congressional representative, House representatives and senators, your federal ones, not your state or local, so the ones going to Washington, D.C., on all of their websites, they have a little button that says, I need help with a federal agency. And you can click that, and most of the time they don't even read it because they don't understand it. So they just, see, oh, this is a Social Security issue. And then they send it to the Social Security regional office, and the regional office sends it to the local area office, and the area office sends it to your particular office. And yeah, those need to be responded by the local office within like 24, 48 hours. So that's how you deal with the bureaucracy. I've got a video on that too. How to fight the bureaucracy. I've got a video on everything. Well, I don't. Yeah, I think I'm probably like 50% there in terms of all the videos I've got. Yeah, every time I talk to someone, I'm like, oh, I got to do a video on that one too. So yeah, I'm going to be doing this for another few decades. All right. Let's see. What's up, Mary? If collecting on one ex-spouse and the other ex-spouse passes away, can I switch over? Married to both for 10 years. Absolutely, 100%. Yes. Good, good, good. Um, Not that person passed away, but good that you recognize that you need to ask that question. Yes, absolutely. When you file for Social Security benefits, when you filed for benefits as divorced spouse that first time, I'm sure they asked you how many other times you were married and yada, yada, yada. And what they were doing is seeing where the most money was. So if that other spouse had been passed away at that time, they would have said, all right, let's go ahead and do that. But now the situation has changed. So yes, call Social Security immediately by the end of the month. That way, you're protected for this month, and tell them that you have heard that your ex has passed away, so you want to file for survivor benefits. So rather than receiving just up to 50% of that person's full benefit amount, you will receive up to 100% of that person's benefit amount. And it up to part depends on how old you are. If you're full retirement age, then you get 100% of what that person was receiving. So yes, it's a beautiful thing. I just don't like being lied to either. Yeah, yeah, the local office saying they're doing it and then they don't do it, and then they drop the ball and completely, yeah. Um, and then she says, okay, so supervisor, then congressman. Yes, yes. Yep, yep. Yeah, unfortunately. And that's yeah, the new commissioner, Martin O'Malley, that just came in, he said he's going to focus on, customer service and wait times and, phone answer rate and all that kind of good stuff. But I've, I met the last 4 or 5 commissioners, and I've had lunch with a few of them, and they've all said that. But now the difference is they have us to light a fire under them and help them. So join me tomorrow so we can put a plan together to improve customer service, so y'all get your money when you're supposed to. All right, let's see. Got a question. Angelique, what's up, Angelique? Widow here, marrying a widower in 2 months. Will I lose my death benefits? I'm only 50. Okay, so yeah, so you're receiving disabled widows benefits. And yeah, there's if the other person's a widow, I've got a video. This one is super, super convoluted. You kind of have to go through, and because there's so many variables. But I have a video, and you'll have to play it super slow until you get to your part. And it's, what's the title of it? The 5 Social Security spouse myths. Hard to say. So the 5 Social Security spouse myths. So watch that one, and then there's 5 situations where marriage and divorce and remarriage and all that kind of stuff pertain. So just find the one that pertains to you, and then I actually put the policy up on the screen, because it is just a nightmare policy to understand. So yeah, so watch that, and hopefully that'll answer your particular question, because it, depends on, if that person is receiving benefits and what type of benefits and all this other kind of stuff. So yeah, it's very, very convoluted. So, but and then if you determine that, you might be okay, call Social Security, and you can make any type of changes. All right, that does my let's see here. Bobby, the girl that does my SSI is so very kind to me. Awesome. I like it. Yes. Yes. Yeah, kind. Yeah, a lot of federal employees, they're completely inundated and stuff. But yeah, my I had close to 100 employees, and I think all my employees were very, very good. The ones that weren't, luckily, we kind of let them go, which is a process that takes forever. And one of the things that you can do to help with that is complain and say, "Hey, this person was really rude to me," and you tell their boss, and this, that, and the other. And they might just have a bad day or something, or they might have lost a lost one, loved one themselves. And so people are people. So the supervisor will take that into account. But if this is the one, was it the straw that broke the camel back? If you're the 15th one that said it, that could be the one that really puts it over, and now we could terminate that person. And so yeah, I've had a lot of situations like that. Someone has complained, I'm like, yes, this is the final complaint, now I can let this person go. So yes, so but that's great, yeah, that's awesome. That yes, and you can do you can write a little thing. There's should have little comment cards, but if not, just write a little note, a little, buy something in the 99-cent store and says you're awesome or something like that. And the next time you have a review, give it to the person, and they will put it in that person's personnel file. And yeah, so that they will definitely appreciate it. Uh, I'm 63, told I should file for disability based on health issues, or should I just file to start Social Security? Good question. Um, Both. You can do both. I did a video on this. It's rib dib is what it's called. It's so you can actually file for disability, but I'm sure you've heard it takes forever to get your disability claim approved, and people need money. So what they do, if they're 62, or survivor 60, then they start their retirement benefits while they're waiting for their disability benefits to be approved. So you can do both. You can file for retirement and get the check started while you're waiting for your disability. And unfortunately, if you get your retirement for 6 months, then when you're approved for disability, the benefit amount will be reduced 6 months as well. So if you can wait for the disability claim to be approved, then just file for that. But if you need some money coming in now, then file a retirement and a disability at the same time. Very easy. Yeah, it's yeah, I've done a lot of those. Let's see here. Marianne, is there a formula to figure out SSDI? My son is struggling with autoimmune disease, now blind in one eye. Doc would sign papers in a millisecond for him, but he's worried about money. Yeah, all you have to do is you can go on ssa.gov, or call. And well, on the ssa.gov, what they have is they give kind of projections. But yeah, I would call Social Security and ask that number, because it's based on his work, how much he paid, how long he worked, how much he paid into Social Security, and all that kind of stuff. So yeah, I need to do a video on, how to best calculate, if you want to do it long division yourself. But if you don't want to, do all that, which I don't recommend, you know, just call Social Security. And unfortunately, yeah, you're going to be on hold forever. And but once you're in there, make sure he's right there, or he calls, and they'll tell him how much his benefit amount would be. And not only that, is once you're on SSDI, Social Security Disability Insurance, you're also eligible for Medicare after 2 years. So the 24, after being on Social Security Disability for 24 months, you're eligible for Medicare. So even if the money itself is not a big deal, to have Medicare there, that might be the thing that puts you over. Cynthia, yeah, unfortunately, sometimes you are forced to be a pest. Yes, in terms of getting something from Social Security, sometimes. Yes, I agree. You have to be. Yeah. How's it going today? Good, good, good. Thank you, thank you. All right. I don't read these things before I pop them up, so everybody, please be nice. Hi, my sis, when her award paid back to do 4 years, but she was in rehab, paid by Medi-Cal, which is Medi-Cal is the Medicaid in California for 6 months. Do they pay her for that 6 months? Um, Oh, yeah, that's case by case. So she was finally won her case, sounds like after 4 years. So that means she probably went to the administrative law judge, and the administrative law judge says, "Hey, Social Security, you should approve this one. You should have approved this case from day one." And then so Social Security had to approve her from day one, going back years. Um, and yeah, unfortunately, part of that Medi-Cal says, okay, because Medi-Cal is a welfare-based program. Medicaid, all of it is Medicaid. It's based on income and resources. So yes, unfortunately. So at the time, Medi-Cal covered her health care because she had low income and resources um, at that time. But then fast forward 4 years later, they gave her money, and that money is for 4 years back. So at the time, she didn't have the money, but she did have the money. So that's how kind of Medi-Cal is probably looking at it, in the sense of, okay, now you've got money, and we spent all this money for your healthcare, and you actually had money. You didn't have money, but you'd had money theoretically in the future. And yeah, so that's unfortunately. But you can always, with any government agency, you can always request a reconsideration and say yes, yes, yes. But with this overpayment that she has, she's got a bunch of debts, and she needs to buy a new car so she can get to the doctors, and yada yada yada. And so you taking that money away is putting her in dire circumstances. So I would yeah, evaluate that and see if you'd like to do that. So Cadillac Jack. Hey, what's up, Cadillac Jack? Thanks for the sharing your years of experience. We all appreciate it. Yeah, thank you. I appreciate it. Thank you, thank you, thank you. All right, I think I skipped some questions here. Let's see. Um, Doctor, based upon that last question about SS and versus SSD, is one better than the other? No, no. So you're probably talking about SSI versus SSDI. So SSI is the welfare-based program, and the most you can get on that this year is what, $943. So those are for people that really didn't pay into the system, or didn't pay, FICA taxes at all. Um, so if your SSDI is, let's say $500, and you don't have any other income or resources, you could qualify for SSI, the welfare-based program, for another essentially $443. So that'll bring you up to 943, the SSI threshold limit. So yeah, so one is not better than the other, but you don't get Medicare with SSI unless you apply from the state for Medicaid, and the state does what's called this Medicare Savings Program, where they pay your Medicare. So, and because people can have Medicare and Medicaid, and if they get that, then they can also have what's um, a Medicare Advantage plan called a dual eligible plan. So, yeah. So there's that, which is a lot of extra benefits and different stuff. So, and if you want help with that, again, Medicare, Medicare Advantage, Medicare Supplements, and all that, make sure you give us a call or email me, and we'll find someone in your neck of the woods to help you out. All right, let's see here. What are the kind of questions? All right. Dun, dun, dun. Just got diagnosed with schizophrenia a month ago. Been out of work for a year due to the symptoms. Didn't understand what was wrong with me. Too soon to file. No, no, absolutely. Please, yeah. Once you stopped working, you should have filed immediately. Because again, yeah, it takes so long to get approved and everything. So please, please, please file. You can do it online. Watch my videos. I just did a series of 4 videos within the last month or so, and it tells you how to file and all the insider tips, tricks, and secrets on filing for disability and doing it right and everything like that. But please, yes, please file immediately, if not sooner. Watch my videos first, and do it before the end of the month, because it's called a protective filing. As long as you do it by the end of the month, you're protected for that month. If you wait until May 1st or 2nd or something, then your benefits possibly won't start until May. So as soon as you get off here today, watch my videos again at the disability videos I just did within the last several weeks. Cynthia, thanks again, Dr. Weir. Yeah, you're welcome. See, thank you so much. You're a blessing to us. Thank you. I appreciate it. Winifred, that's my one of my relatives' names. All right, let's see what kind of questions we got. Let me see. I'm 45. I'm not expecting to have it by the time I'm eligible. No, that really depends on us. If we demand that our politicians keep it and strengthen it, then we should be able to get it. But it's completely on us. Will I lose my widow benefits if I remarry at 50? Again, I would, watch my video on that, because it's so convoluted, and each case is specific. And unfortunately, Social Security employees don't know all the gory details. They will have to look it up as well. So that's why I put the actual references in that video I did with the reference. They're called POMs. There's over 20,000 pages. Nobody can, I've gone through all 20,000 pages more times than I remember. But anyway, so watch that video, the 5 myths, the spouse myths, and get the one that pertains to you. Write down the reference number, and that way when you call Social Security and tell them this, that, or the other, and they say, no, that's not right, and you say, well, look it up, here's the number, and they're like, wow, who you been talking to? I was approved for disability, although the amount cannot carry me through the month. Can I try and increase it? Yeah, unfortunately, VA benefits, I had a lot of veterans in my office, and they were collecting, VA disability, 10%, 20%, 30%. So you hear that all the time, that oh, I've got 10%, I'm trying to increase it to 20% and stuff. Social Security doesn't have that. You're either disabled or you're not. So if you're receiving disability, that's your amount. You want to make sure your amount is correct. And how do you do that is you watch one of my videos on how to do that. But super long story short, you make sure your earnings, because your benefit amount is based on how much you actually paid into Social Security. So if your earnings record is correct, how do you check that? You go to ssa.gov and you look at your earnings record and say, oh, okay, yeah, everything looks correct there. There's no, zero gaps, or, if you're making below $943, then you might be eligible for SSI if you don't have any other income and resources. And then I guess watch my videos. I did a set of 4 videos on living on Social Security alone. And there are 48 different programs and things out there that can help you. And I apologize for the first video. The introduction is really slow. Everybody complains about the introduction. You can just fast forward through my boring. I think the introduction was important, but a lot of people didn't agree with me. So what are you gonna do? So watch those videos, and hopefully there's something in there that can help you out. So, all right, let's see. Will my wife get her spouse benefits when my Social Security starts? She signed up when I did. Yes, but she has to file a claim for spouse benefits. So if you both go in there together and you're both entitled to benefits on your own record, so what will happen is you file your claim for retirement benefits, she files her claim for retirement benefits, and then she files another claim for spouse benefits on your record if your benefit amount is over twice hers, and she'll receive the difference. Yep. So yeah, it's not automatic. She actually has to file. And if she's her full retirement age, she can receive 50% of your benefit amount. If I don't take prescribed medication for mental health, will that affect benefits eligibility? No, 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 no. But yeah, watch my video on that. I kind of talk about that. As long as you document it, um, if you're filing for disability and the doctor, has told you that, okay, you need to take this medication to improve your disability, and you say no, I don't want to take it. Social Security might just deny you because the doctor is telling you how to fix yourself, but you don't want to fix yourself. But if the reason you're not taking it is because the side effects are far worse, then make sure you document that down there, and watch my video about taking notes about all that, because doctors are terrible about taking notes, or taking notes that you can actually read. So yeah, if you don't want to take the medication or it follows the doctor's orders, then that's on you. But you have to have some type of justification that, yeah, he told me I should do this, but it makes me feel 10 times worse. And so my issue is this, but the side effects of that are just as bad, if not worse. And therefore, regardless of the fact I can't work, because that's how Social Security defines disability, as the inability to work. So if you can't work because of your disability or the side effects of the medication that help your disability, then yeah, that's the issue. So all right. So yeah, make sure you watch those 4 videos you um, before you start your application online. Or if you want to just if you don't want to do it online, you just want to call and have an appointment, then immediately call, set up an appointment, and then watch my videos. Yep. So dun, dun, dun. All right, let's see. Glenn, I'm cut off here. Long question. All right, no problem. Hi, Dr. Ed. Can Medicaid ask you to pay back for services if they kept you on a program even after you told them about asset disqualification, and even through the wind down, renewed again? All right, let me take that out. Yeah, that's kind of like the question I got just a little bit ago. Back pay and all that. Yeah, unfortunately, they can ask you to do anything. With Social Security overpayments has become a big thing politically and publicly because of Anderson Cooper's 60 Minutes segment. Good thing on Anderson Cooper, yay Anderson Cooper. But yeah, they can ask you to do anything, but you can also request a reconsideration of anything. So if you, I don't know, if Medicaid is run by the states. I used to work for Medicaid, Department of Social Services, and each state is different. So I would request and say, hey, for Social Security overpayments, 2 things have to be met. It's not your fault, and you don't have the ability to repay. So if Social Security obviously made a mistake, then hey, that's good. Then that's, well, it's not good, but it's not your fault. But if you just won the lottery, now you got $20 million, and they're saying, "Hey, pay us back $1,000." No, it's like, you have, even though it's not your fault, you have the ability to repay that $1,000. Come on, So they're looking out for taxpayers, and whatever the case may be. But yeah, request a reconsideration and say, "Hey, it's not my fault; it was your fault." And yeah, let's see here. Slow mo. I am 100% VA and I'm on OPM disability. What are my chances of getting SSDI? Yeah, the VA thing, that's a different thing. You have to redo the whole disability completely again. Um, so, but because the VA has all your medical records, the Social Security Administration, they have an electronic transfer of records once you give them that authorization. So it's pretty easy for them to get your medical records once you authorize them to do so. So that's good. So yeah, again, watch my 4 videos on Medicare, or excuse me, on filing for disability, and then yeah, do it to it. Yeah, but again, for the VA, the whole work thing doesn't really matter because for the VA, because again, I've had dozens and dozens of employees in my office that were receiving VA disability, but they were working. But for Social Security, that means they're not disabled. You're like, well, yeah, the person's definitely disabled, but they're working. Social Security defines disability as the inability to work. So, Social Security was started by this guy named FDR, who was in a wheelchair, had polio. So he was disabled, but for his program that he started, he's not disabled because he was working, being the president of the United States. So there's that. Do you have SSI or SS benefits video for a child who is 21, just one judgment? The disability is based on his mother who passed away. Um, God, you're killing me. That's another video I've been meaning to do. Yeah. So it's basically, it's basically a disability claim, and what referencing is, um, if a parent is receiving retirement or disability or has passed away or something, a child 16 and under can receive child benefits, or excuse me, 18 and under. The parent can receive child and care if the child is under 16. But yeah, so the child can receive benefits if they're under 18, or if they're still in high school up until 19 in a couple of months. But if the child became disabled before the age of 22, they can file on the parent record if the parent is receiving retirement, disability, or has passed away. And this sounds like what you did. So it looks like you're 95% there. You're pretty much done. If they were approved, then awesome. I do have a video on, now that you're approved for disability, what now? What next? And then it lays out all the stuff about, work requirements and, direct deposit and continuing disability review and all that kind of stuff. So watch that one. It's labeled, it's titled, approved for disability, what's next? Now that you're on disability, what's next? So watch that one. I really need to do one on um, the part that you've already done. All the part about actually winning the case for disability, a disabled adult child. So I need to do a video on that. But you've already got that. So CD, Semper Fi, hey, hoorah. Is there any advantage for me to file for disability while taking spousal benefits? I am 65 years old, woman, and currently on QMB with my husband. I will lose QMB when the Social Security starts. So QMB, this is a Medicaid category from the state. So she's receiving Medicaid, and there's QI, qualified individual, and SlimB, and QIMB, and QMB, and different levels of Medicaid. And they, if you get the higher levels of Medicaid, they pay for your Medicare. So again, you can have Medicare and Medicaid. And if you have the higher levels of Medicaid, they pay for your actual Part B premium, all that kind of stuff. Is there an advantage to file for disability? You're 65. Yeah, it really depends on the money. So it doesn't matter, you get Medicare after 24 months, you already have Medicare, so that's not an issue. That's not a consideration. You're already 65, so it doesn't matter. There could be extra money there if you're approved, and so it doesn't hurt. It really depends on the benefit amount. If there's more money there on disability, then absolutely 100% try for it. And then when your Social Security starts, you're going to lose your QIMBY, and therefore you're going to lose your, you're probably, if you have a Medicare Advantage, a lot of people get the Medicare Advantage dual eligible. And I usually always recommend Medicare Supplements if it's in your budget, unless you are receiving Medicare and Medicaid. Then a lot of people get Medicare Advantage dual eligible plans. And there's a whole bunch of other benefits in there based on depending on where you live and everything. If you're going to be losing your Medicaid or that status, then you're also going to be losing your Medicare, the Medicare Advantage dual eligible plan. So make sure, you give us a call there, and we can have someone reach out to you and find you a new plan, a regular Medicare Advantage or a Medicare Supplement or whichever you want to do. And that's a free service. And so, yep. Let's see. All right. Let's see what other kind of TikTok questions I have here. So please, yeah, TikTok. It's hard. I don't do it regularly because I don't have 10,000 subscribers yet. So if y'all help me out, I can do TikTok a little bit better. I've got just another old phone sitting up here doing. Peg, I will be 65 in October. Do I need to apply for Social Security insurance? So Medicare. It depends if you're currently working. If you're currently working and you have health insurance from work, yours or your spouse's work, and your employer or his or her employer has 20 or more employees, then you don't have to sign up. So if you're working, have health insurance, and you're happy with it, obviously, you want to do that. You want to make sure it's as good or better than Medicare. But if you're happy with it, then yeah, just keep on keeping on. And once you stop working, at 66, 67, 70, 80, whatever the case may be, and at that time you just sign up for Part A, Part B, and there's no penalty whatsoever. You just have to jump through a couple extra hoops, prove that you did have health insurance since you turned 65. But yeah, save yourself the $174, and don't pay for Part B. But you can sign up for Part A if you want. That's what some people do. Even if they have health insurance from work and they're happy with it, they say, well, Part A is free, and it's doesn't hurt to have some extra coverage. But what a lot of Social Security employees don't know is if you are contributing to an HSA, a health savings account, then you can't contribute to an HSA anymore once you start receiving Part A, Medicare Part A. You can withdraw those funds, but you can't contribute anymore once you start a Part A and have a health savings account. So, but if that doesn't apply to you and you don't have health insurance and all that kind of good stuff, then yeah, you go ahead and sign up for Medicare. If you're already receiving Social Security benefits, you don't have to do anything. It's automatic. About 100 days before you reach your 65th birthday, Medicare will send you your package and all that kind of good stuff. But you're looking at October, so time flies. So I would definitely, if you're going to sign up for Part A and Part B, make sure you figure out how you're going to cover all those gaps, and watch my videos on Medicare Advantage and supplements and all that kind of stuff, and then reach out to us if you want a recommendation. We'll have someone give you a call and go through all your options, and that is a free service. Let's see here. If you are on disability at age 66, you're probably, yeah, well, you might still be on disability. Can you file to get a part of ex-husband's retirement? Yeah, absolutely. A Social Security retirement, if their benefit amount is twice your amount, then yes, you can absolutely do that. Once you hit your full retirement age, you're going to switch to regular retirement, so you're not going to be on disability anymore. Let's see here. Recommend taking Social Security at 62 if you're financially able to do it. Yeah, there is. I did kind of a sarcastic, funny video about all these financial advisors out there giving you all that recommendations on when to take retirement and all that kind of stuff. And she'd take it at 62 or 65 or 67 or 70. But nobody knows. And I said the only 100% perfect way you can know when to take your Social Security benefits is if you know your DOD, your date of death. If you know that, then you know exactly when to take it. Oh, I'm not going to die for another 60 years. Then wait till you're 70 years old, or So yeah, it's you just do your best, and if you're not working, or if you're under your annual earnings limit, which is the $22,320 this year, then yeah, 62. A lot of people take it at 62. And but that's not written in stone. If you take it at 62 because you're going to stop working, you're tired and you're tired of working, you just want to go ahead and relax, and you're going to be under the annual earnings limit, and then you stop working and you know you get bored like I did after 10 days, and then you start doing crazy stuff like this again, and then so you can always stop your benefits after a year, 6 months, 2 years or something. And it's like, oh yeah, someone offered me a good job, and so just call up Social Security and said, yep, thanks, but no thanks, stop your benefits, and they will automatically readjust your benefits once you hit your full retirement age. So if you take a maximum reduction at 62, which is about 30%, and then you know you stop taking your benefits for a year or 2 years or 3 years, once you hit your full retirement age, Social Security looks at that and they recalculate your benefits and they increase your benefits accordingly. So yeah, so it's not written in stone. So you can start at 62 and then change your mind. Yep, it's a beautiful thing. Uh, d- d- I am on disability now, but turning 65. Will I be able to work with our reporting it without reporting it now? Um, so yeah, once you hit your full retirement age, you're switched over to retirement, and so you no longer have any work limitations. So you can make $1 billion a month. It's no problem. Um, but being 65 right now, you still technically have to go by your disability limitations. However, trick of the trade here, if you have a trial work period, so for 9 months, you could have always done this, but if you never use those trial work period months, you have 9 months, so you can work and you can make $10,000 a month for 9 months, and then at that time decide, "Oh, okay, I'm going to continue working or whatever." But by that time, you might be your full retirement age. So yeah, it gets kind of convoluted when you're about 65. So if you're 9 months away from your full retirement age, then I'm not saying to, to work the system, but that is the system. If the billionaires can work the system and not pay taxes, and I guess the rest of us schmucks can kind of do the same, right? So there's that. There's my commentary for today. Suze Thomas, I called your main number and called me. Nobody called you back. Oh no, was it about? Yeah, the only in terms of um, yeah, that number is for my network partners in sense of Medicare, burial insurance, Medicare Advantage, supplements, and all that kind of stuff, estate planning. Yeah, I just personally, yeah, I can't really. It's difficult, if not impossible. That's why I do these lives. Um, so if it's a Social Security question, then I answer it here. But yeah, if you called about Medicare and nobody called you back, please email me, ed at mygov expert. I got my email down there. Yeah. So if it's about, again, Medicare, you need help with one of the network brokers, yeah, email me and I'll have someone contact you immediately, if not sooner. Sorry about that. All right, let's see here. We wanted to keep this to about an hour, so I'll do a few more questions and then we'll call it a day. Let's see here. Can I receive Social Security survivor benefits if I'm retired overseas in a country that is on the good list, like Philippines or Thailand? Yeah, so if it looks like you already checked the good list, so go into the SSA website. It's all depends on your citizenship or green card, what type of benefits you're receiving, what country you're in. So it's all very, very specific. So Social Security has a what's the exact name of it? It's called the Payments Abroad Screening Tool. So it asks you 4 or 5 or 6 questions, and then it'll tell you exactly whether you can do it. I know for sure No North Korea, no Cuba, but pretty much anywhere else, it depends on a lot of variables. So, all right. So unfortunately, I'm at an hour here, so I'm going to do another live Q&A. I'm just going to keep doing live Q&A. There's so many questions out there. So as long as I have a little bit time here and there, I'll continue to do live Q&As. But my regularly scheduled live Q&A with what we can do about customer service will be tomorrow. So please join me then. And I apologize for all the questions. I did join me tomorrow, or sometimes I'm just going to keep doing Q&As pretty much almost every day. So there's that. Yeah, so many people out there need help, and I've got a little bit of time every day. So, all righty. Well, y'all have a great night, and we'll see